What's up, hackers? My name's Colin, and in this video, we're going to take a deep dive into MDMA as a treatment for PTSD. We're going to look at how it works, and why it's going to change the way we look at mental health forever. All that is coming up right here on Mind Hive. According to the APA, PTSD is a psychiatric disorder that can occur in people who have experienced or witnessed a traumatic event such as a natural disaster, a serious accident, a terrorist act, war, combat, rape, or other violent personal assault. It can also be caused by prolonged exposure to a series of stressful events, like in the case of childhood abuse or neglect. According to the Veterans Association website on PTSD, 1 in 11 Americans will be diagnosed with PTSD at some point in their life. Some studies have shown that the rate of PTSD among veterans can be as high as 20 to 30%. And women are more than twice as likely to develop PTSD when compared to men. The symptoms of PTSD include hypervigilance, or always being on high alert. In other words, your fight or flight response is always activated. Another symptom is avoidance, or trying to get away from trauma-inducing situations or events. Re-experiencing the trauma in the form of scary thoughts or nightmares is also very common. And those with PTSD are at a significantly higher risk of drug abuse, depression, anxiety, unemployment, and suicide. From an economic perspective, $17 billion every year goes towards veterans who have to be on disability because of PTSD. And if we take a bird's eye view on it and look beyond just PTSD, we can see that $309 billion goes towards mental health prescriptions every year. The main way PTSD is currently treated is with psychotherapy and antidepressants. Now, the main problem with this is that the antidepressants don't actually get at the root cause, which is the trauma itself. You have to take the drugs every single day. They usually come with a lot of side effects, and if you stop taking them, the risk of suicide can actually increase. And lastly, even with regular psychotherapy sessions, it can take years for a patient to notice any real change in their condition. Some people will go to psychotherapy for decades and still meet the PTSD criteria, meaning their condition hasn't actually gone away. So the question becomes, is there a better way? And a lot of recent research is starting to show that yes, there is a better way, with something called MDMA-assisted psychotherapy. Now, before I dive into what that actually is, I think it's important to talk about the drug itself, which is MDMA. Methylene dioxyamphetamine, or MDMA, is a synthetic drug first used by psychotherapists in the 1960s to treat patients suffering from mental illnesses. This continued into the mid-1980s until the US government banned their use under the Controlled Substances Act. But with the help of MAPS, the Multidisciplinary Association for Psychedelic Studies, MDMA is now making its way back into the field of medicine. One 2019 study looked at veterans and first responders with PTSD over 3 MDMA psychotherapy sessions. Before the first session, each patient was assessed using the Clinician-Administered PTSD Scale, or CAPS. Anything over 60 on the scale is considered severe, and every participant in the study scored 50 or higher on the scale. At the end of the 3 sessions, the group receiving treatment saw an average reduction of 45 points on their CAPS score. 54% of the participants no longer met the PTSD criteria after 3 sessions. Other studies have seen reduction rates as high as 68%. And what's most amazing, and what other studies are finding as well, is that the reduction in symptoms continued long after the therapy sessions were over. So what's really going on here? Why does MDMA work so well in a psychotherapy setting? The answer isn't entirely clear yet, but one thing we do know is that MDMA works on serotonin and norepinephrine receptors in the brain to increase pro-social behavior in humans. MDMA also boosts levels of the hormone oxytocin, which is the same hormone that's observed in mothers who are nursing. In a psychotherapy context, oxytocin creates a trusting bond between doctor and patient and allows the patient to open up more and feel that they're safe and secure. Now, along those same lines, MDMA also reduces activity in the amygdala, which is responsible for the fear response that's associated with PTSD. So when there's less activity going on in the amygdala, a patient can recall traumatic experiences without triggering that emotional response. And here's the most interesting part to me. MDMA induces a state of hypermnesia, which is enhanced memory. It's the opposite of amnesia. And what these trials have shown us is that memory doesn't work the way we once thought it did. We used to think that memories were just encoded and then stored in this static state. They were almost just frozen in place. But what we found recently is that every time you bring a memory to the forefront of your mind, every time you recall a memory, you actually end up reconsolidating it. You reaffirm certain things about that memory, which may or may not be consistent with the way that you originally remembered it. This is how we end up misremembering things, and it's one of the reasons why MDMA works so well. As I mentioned, MDMA induces a state of hypermnesia. So when you recall a memory, you recall very specific and vivid details regarding it. At the same time, your fear response is turned way down, so you can look at that memory for what it is instead of reacting to it emotionally. And when it's all said and done and you've had that major breakthrough during the session, you're able to reconsolidate the memory with those new positive emotions that you cultivated through the therapy. Right now, it appears that patients who have undergone these treatments have been able to retroactively change their memories and in the process reduce their symptoms of PTSD significantly, or even free themselves of the disorder altogether. And the best part is that MDMA treatments only take about 10 weeks instead of years and decades even of psychotherapy. And researchers who have been testing out this new approach haven't noticed any withdrawal or addiction symptoms associated with MDMA. And the side effects appear to only be limited to the time that the patient is in the therapy session. And they're usually things like jaw clenching, nausea, or an elevated body temperature. FDA approval for MDMA-assisted psychotherapy could come as early as 2021, potentially changing hundreds of thousands of lives for those debilitated by PTSD. If you want to learn more about MDMA-assisted psychotherapy or other forms of psychedelic-assisted therapy, I'll leave a link to the MAPS Foundation in the description for you to check out. And for any of you that want to learn more about relationship trauma specifically, I'll also leave a link to a resource on that. Thanks for watching. If you liked this video, if it struck a chord with you, be sure to hit that like button. Be sure to put any comments below, any questions that you have about MDMA-assisted psychotherapy. And if you vibe with the content on this channel, if you like what we're putting out, go ahead and hit that subscribe button as well. And as always, happy hacking.